Nevada is a vast state where access to healthcare isn't always easy. That's why in 2000, a pink beacon of hope hit the road. It was called the Mammovan, launched by Nevada Health Centers with a mission to bring life-saving mammograms to women across our state, no matter their zip code, income, or insurance status. For 25 years, the Mammovan has rolled through deserts, mountains, and cities, ensuring that every woman 40 and older has access to early detection and the care she deserves.
Well, I was on my daily walk with my friend, and 47 years old, and we were just talking on our walk, just having a conversation, and she mentioned to me that she had gotten her mammogram done that morning. And I had recently at that time been feeling a little bit of pain in my left breast, some lumps. And I thought, well, I should go get it taken care of.
I noticed there was a problem on my breast probably 2 years prior. And I went to my physician and was told that because I felt a lump, and then I started having problems with my lymph nodes. And then I was told that I was probably a cold or some kind of infection, and I was kind of pushed off there as well.
I had been taking care of my late husband for about 4 years. And so just really got caught up in his health and what was going on with him. It was September of 14, so it was about a year or so after my husband had passed. And I noticed on my left breast on the side, you could see that something was definitely not right.
In 2018, I was hired to do a news story on Nevada Health Center's Mammovan. I was very excited about doing this project. I was very interested in the accessibility of the Mammovan.
I was cleaning around the house and the Mammovan commercial came on, and it was in my area. I was like, well, I don't have an excuse. It's a Mammovan. It's on my side of town, and I really don't even need insurance, even though I had it.
I told them, I said I didn't have any money or any insurance. And they said, Charlo, you don't have to worry about it. Just come on down and we'll take care of you.
The Mammovan actually is a part of Nevada Health Centers. And so every program at Nevada Health Centers, our mission is to provide access to healthcare services for people throughout Nevada. So for the Mammovan, the mission is to provide access to breast cancer screening services for women 40 and older living in the state of Nevada. We're open to any woman in need. It doesn't matter if they're insured or uninsured. Our goal is to get them on and get them screened and get them on their way to good health.
Immediately, the people, they were so loving and so warm that I felt comfortable. And when she started to do my exam, she immediately knew there was a problem as well. I think I went on a Saturday. By that Tuesday, someone had called me and said, hey, you need to get in to get another mammogram. We're going to rush this over for you. And not only did they do that, but they kept in touch with me every step of the way.
My experience, the staff, everybody they were just so sweet, and just explaining everything. It just made it so much nicer.
I did get my results back and was told by the team on the Mammovan that I had calcium deposits that were found on my left breast. The Mammovan team was just incredible, filling me full of knowledge, just letting me know that at this time there was only about 10 to 15 tiny little calcium deposits, but that this was something that I would definitely want to be watching over the years. And it was even more imperative now that I stuck with that regimen of getting my mammogram yearly.
To operate the Mammovan on an annual basis, it's one of 5 mobile units that our organization runs. And it is by far our most challenging as far as expense-wise goes. It's about $1.3 million annually in operating expenses. And so having a semi-truck that needs maintenance and tires and gasoline and a generator that works and whole logic screening equipment is a lot of the expense. But we also pay to have our images read and our images stored and have our team travel through the state. They're on the road about 2 weeks a month. So hotels and food and airfare and, all those kind of things add up.
My life has changed since the mammogram because I was diagnosed with breast cancer. And if I would have not had that conversation that day with my friend and about how, she told me just to call, I would have let it go. And I'm glad I didn't, because I did it for my family and I did it for myself. Doesn't matter if you don't have insurance or not. You need to go because it's important to your family and it's important to you.
Cancer is a death sentence, and in my case it wasn't, and I attribute that to the Mammovan. And triple negative breast cancer, it spreads very rapidly, but it's easily treated from what the doctor had said. I just knew that I needed to get it taken care of, and you just push through it, scared or not. First thing I thought of was my kids and my grandkids. It's been 9 years. February was 9 years, and I absolutely can't believe that 9 years has gone by. And I'm here.
In 2023, my mother was diagnosed with breast cancer. So during that time, throughout that year, I was back and forth between Nevada and Seattle, Washington, caring for my mom. And I honestly just didn't get my mammogram done. In 2024, I went and did have another mammogram done. And that was when I was told that the calcium deposits that I had completely exploded. And each one of these was a concern, especially because the ones that we had seen during the initial mammogram that I had on the Mammovan had started to mutate. I'm very lucky that I did not have cancer, but I truly believe that I owe all of this to getting my mammogram on the Mammovan.
I didn't feel alone. And so it was reassuring. Now, when I went to get the mammogram, of course, I was a stage 2 breast cancer, and it had spread to my lymph nodes. And I had to immediately start chemo right away. When they knew something was wrong, they immediately went into the support mode. And for years, she never stopped calling to check on me. And when I'd say her name is Rhonda, amazing. It's just been a blessing to have that kind of community. African Americans and doctors, there's a systemic issue there and trust because of things that have happened to us. So I want to acknowledge that. But I also know that there are good doctors out there doing good work, and that, early detection is what saves lives.
Listening to the stories of our patients, heartbreaking stories for me that they waited to come on because of fear. And it's just so incredibly important that these women come out annually. And for those that we can help them have a longer life, get treatment sooner, because we know the outcome of those ladies that don't. Without the Mammovan, nearly 3,000 women a year would go without screenings. $350 for a mammogram can extend someone's life. It can, help them celebrate more years with their family and their children. And there's nothing that can describe how far that can go.
Well, I think it's very important that the Mammovan is out there for people like me who didn't have the insurance at the time and who didn't have the finances at the time. And the donors are the ones who are making it possible for people like me that don't have insurance. And so that's why my message is for all these women out there is to call and get your mammogram, because you don't have to have insurance. You don't have to have your finances in order. You just need to go because they are willing to take you.
They've been out here in Pahrump, and I see them, seeing the van parked at Smith's grocery store on 160, and women coming in and out, and I just would really like for them to be able to continue. So donations, I think at this point are really, really important, so you guys can continue doing the work that you do.
This is a resource that we vitally need in our community to continue to keep women healthy.
So if someone is wanting to give to the Mammovan, there's a variety of ways that they could do that. We certainly accept donations right on the van, and many of our patients give us donations of all sizes, and every single dollar counts. They can go to our Nevada Health Center's website and access the donation section so they can give that way. And another great way, and something I participate in, is through our license plate program. Through the state of Nevada DMV, we have a breast cancer license plate, has a pink ribbon on it. Most people probably see it and don't realize where the dollars go, but it comes back to Nevada Health Centers to the Mammovan. And it's about $20 each year after you register the car that comes in a donation. We bring in about $100,000 a year to the license plate program. So it's a wonderful way to do something and promote breast cancer awareness every day when you're driving somewhere and contribute to the program as well.
For 25 years, the Mammovan has been more than a clinic on wheels. It's been a lifeline. It's rolled through our towns, our neighborhoods, and our rural roads, bringing hope, care, and connection to every woman who steps on board. You can help keep it rolling. To learn more, make a donation, or to schedule a screening, visit nvhealthcenters.org or call 877-581-6266. Because together, we save lives. The Mammovan provides screening mammography only. Women experiencing symptoms such as pain, lumps in breast tissue, changes in breast appearance should consult their primary care provider for appropriate guidance on recommended next steps.